So I think there are several. The most obvious, I think, is the moral status of the early human embryo, or the fetal tissue and fetal tissue transplants. I think there's real pluralism with how people feel about the value and therefore the protection and rights of that very early human entity. And related to that is the question of whether we should be allowed to create these very early human embryos, blastocysts at 5 to 7 days gestation, specifically for research, or whether that's a step too far into sort of the commodification of human tissue. So I think those are really big questions for anybody working in the field. But arguably, I think even more important for those of us working with patients is the commercialisation, the proliferation of these for-profit private stem cell clinics that purport to be able to mitigate and cure disease outside of clinical trials in an unproven, unregulated way. And I think the proliferation of those clinics, I think there's almost 3,000 in the United States alone, is of real concern for those of us who are both clinical or working on the ethical side of things.